reproductive system is just two, right? One is in the male and another is in female. Okay. Now these are all we have we have studied that it's totally two different types, right? You see, male and a female, different components are there, right? So why we have to study reproductive system is the way it is formed, and there's a lot of complexity involved in it. There is a lot of indefinite answers to that, and so many anomalies, and a lot many things happen over this development of it. It could be as simple as what you have already studied, like undescended testis, or it could be just Turner syndrome, which you have studied in your school, who have a streak ovaries or ovary which is not developed. Okay, there could be a variety of problems starting from induction till the final formation of the organs, right? So that's about the reproductive system. So this reproductive system is divided into three categories we have to study. One is the gonads, in which the testis and ovary are, all the ova and the spermatozoa are placed inside. And the duct system, which carries these ova and the sperms in and out. And the external genitalia, it's a portal of exit and entry. Okay. So these are three, and it's a huge topic. So today we will restrict our topic only to the gonads. Okay. So external genitalia, I think it's over, and we have another class on ductal system. Okay. So when we talk about gonads, so what are the gonads you can think of? Testis and ovary. Okay. Now, are they totally different? Are they going to signify who you are? I mean, going to identify who you are? Yes or no? Yes, and somebody said no. So I always different answers here. So why no? Is it going to differentiate? Okay, we do not know whether it is going to identify or not, but any pregnant mom, whenever she is pregnant, all she wants is to know whether it's a boy or a girl. Okay, it doesn't matter if it's a boy or a girl, but do we have a choice in that? We have a choice? Yes, do we have a choice? Somebody said yes. How? Okay, fine. So when it comes to pregnancy and whether it's determining the sex of the baby, do we have a choice? Let's see whether we have a choice or not. Okay, so whether it's a male or female or indifferent, we do not know how and when it is decided. We should know that it is not at the time of development, or it is not later in the time of development. It is all predetermined. Okay, the sex determination happens right at the time of fertilization, and later on from the time of fertilization, it is determined, it is predetermined that this gonad is either going to be a female or a male. Later on, many components are going to come and differentiate it into a certain way, testis or an ovary. Okay, so we know this XY mating with the XX female, we have only two components. If X is XX, XY and XY. So 50% chances of XX and XY is there. So, but we cannot choose which one is going to happen and which is the next progeny. Okay, so it is at the moment where the fertilization happens, it's all determined. But then what goes wrong and where it goes wrong. So we'll see that. So our pregnant mom does not know all that. She goes to once she knows she's suspecting pregnancy, she goes to the doctor and then she asks. Okay, so she asks for confirmation, and the next question she asks is, what is the sex of the baby? Right. So this is how she's like, she's just gone for a confirmation, and this is how it looks like. So it's like, a dumbbell or a very, very small, rich kind of a thing. That's how you see until 7th week. Okay. Until 7th week, the doctor says, no, I cannot really differentiate whether it's a male or female. All I can see is a blob of tissue over there, and I cannot see. But if she had gone after that, after 7th week, do you think the doctor can say what is the sex of the baby in India? We have this. All you have to carry on this message is this is definitely you have to know. This law protects the baby. It's for in good. It has been brought in 94 and it's been modified so many times. And then this is sex selection. It's a prevention of sex selection, and you cannot know the sex of the baby is born, and you don't have a choice in India. Elsewhere, there are countries which do not follow this. Okay, so we have this PNGT Act, and any ultrasound you use, you have to have this Act. Okay, now the sex determination comes from a common structure. You can see this one common structure, and it can go either as a testis or an ovary. Okay, or ova or whatever it is. So now happens because it's already decided, but then how the same kind of structures are going to completely differentiate into two different ways. So that's what we have to see. So until 7th week of fertilization, until the fertilizations happen, there is a stage called indefinite stage. That is, whatever it looks same both in male as well as in female. Okay, that's how it looks like. And this is called the indefinite stage. Okay, fine. What's his name? You just came from and I'm not the reason for you to put you sleep, right? So you just go. So what's the problem? Like, you saw this and went to sleep, or saw that and went to sleep? Yeah. Okay, guys. Like, let's just get up and wriggle a little bit and get down. I don't want any heads going down and down and down. Okay, right. Okay. I don't think there was any match yesterday, was there? Then what is the reason for you to doze off here? Yesterday's effect, day before yesterday's? Okay. Yeah, fine. Okay, right. Fine. In this way, it is going to be really difficult to proceed. Okay, we have an undifferentiated gonad, which is not going to tell us either it's a testis or ovary. And at certain point, we know that we are going to have some differentiation. Okay, so until 7th week, we have a stage called undifferentiated or indefinite stage, where we cannot say what is it. Okay, now, so where does it start? It starts. It's along with the urinary system. It's somewhere near that. But after the urinary system has established, if you study the urinary system, we know that there's something called mesonephros, paramesonephros, the ducts of that, all that. So somewhere near that, we have, after it starts developing, this reproductive system of gonads is going to start developing. Okay. So where it is start, which part of the layer you think it's going to develop from? Which part of the layer? Is the endoderm, mesoderm, or where is it coming from? Endoderm? Mesoderm? Mesonephrosis is from where? Mesonephrosis? Yeah, okay. So to be more exact, it is the intermediate mesoderm, and then the surrounding places wherever it goes is, we'll see where all it is. But the origin, the action where it is going to differentiate is the intermediate mesenchyme. So we'll see many factors are also contributing. So what are the structures? So what are the structures? The basic components which are required for formation of this ovary and testis are three. One is the gonadal ridge, another is the SRY gene, and the most important, the primordial germ cells. Okay, so these are the three things, and one more will be there. When gonadal ridge is split into two, you will see there are two components. So the primordial germ cells, the gonadal ridge, and the SRY is going to go and tell us to either become a male or female. These are three components which are going to become the testis or ovary. Okay, so this is how it looks like. This fetus, which is looking like this. This is the yolk sac, and this is how it looks like. If you take a cut section here, and this is our yolk sac, and our primordial germ cells are going to come from here and then go here and somewhere migrate here, and then this is where the actual things are happening. So we have a primordial germ cells, we have a gonadal ridge here, and we have a SRY which is already predetermined, and these people are going to determine our sex determination. Okay, so this is something, if you just cut it and then take the top and then see from above, this is how it looks like. This is the cavity, this is the gut. On either side we have the mesonephros or something, and this is where all the content are going to come out from. Okay, now this development of gonads, it's not just the genetic component, but also sex hormones, and very important is timing of development. It's a complex organization of this. Anything goes wrong, starting from genetic genetic component or this hormones, or in any problem with the timings, something can go wrong. Okay, so we'll just see a fast like what has already happened from the fetus. So from fertilization, we have this blastocyst getting implanted, and then it gets into the uterine cavity here, and then it forms the two cell stages here. Okay, and then this is the cavity which is there. So we are going to get the trilaminar disc. So we just cut like this and go and see that. And this is the trilaminar disc formation. This is the primitive stick over here. Somewhere here our job starts here. So from here the cells are migrating, and you can see if you just cut here, and this is what it looks like. This is the trilaminar disc is forming. And this is the final stage. So we have this one cavity here and one cavity here. This is the two cavities, and we have this primitive stick over here, and the three layers are formed. Now this three layer, if you take to the next component, this is how it looks like. If you just take a section here, this is how three layers are started. You can see this is the mesoderm here, which is going to differentiate into intermediate, and lateral, and paraxial. So this is where our all the gonadal ridge are going to get differentiated. Okay, so when the body foldings happen, this is going to get incorporated. This is going to form the gut over here, and this is the yolk sac which is going to here. So from here, our cells from here, the cells are going to migrate from here, go over here, and somewhere it is going to go and induce the organs here. Okay, so once it is completely the body folding has happened, this is gut has been almost separated, and only small part has been hanging. That's the yolk sac. Okay, so this is how it looks like. So this is the fetus, like with the head end and the caudal end. This is the yolk sac here. This is the connecting stalk over here. So now from here, so our concern is from this wall of this yolk sac, a migration of this wall of yolk sac will go. This is the gut here. On either side of this gut, see, this is the gut. If you take a section over here, this is the gut. On either side of this gut, on this near some, if you call this is the anterior abdominal wall, this is the posterior abdominal wall. Around this region where our kidneys are developing, this region, which is this is the intermediate, zone. This region, there is some kind of elevations. Okay, so these are going to go and form the urinary system. Along with that, we are going to have some kind of a elevation which is getting formed. Okay, so take, if this is the head end, this is the caudal end. If you take a section over here, this is with the yolk sac. Okay, if you take a section over here and put it, you take a section, take off this head part, and just see from above. Okay, see from above. Now we are going to tilt it, and we are going to only take this part of it, right? So when you're going to take all this, this is how you get it, right? This part of it, only this part. This part is somewhere, okay, somewhere here. So from yolk sac, something is going to go there, and somewhere here, not at the head end, not in the middle, somewhere over here, somewhere near the lumbar region, or just lower down. In this region, all this process is happening, and we are going to look into that region. If you take a section here, we are not going to see what we are seeing. If you go very caudally, we'll not be able to see. So somewhere near this, if you go to a section, to see this, this kind of a structure, right? So all we want is a gonad, and we want two gonads. One is the testis and the ovary. Okay. So if that is the intermediate mesodome is the only thing we have, and we have to get all these components. You can see the difference in component. Look at this testis with a thick cover, and all the septas are there, and some tubules are there. On the contrary, here we don't have any kind of tubules. All we have is a cyst like a follicles over here, and we have this tubular structures connecting here. We don't have such kind of things. All we have is the vascular stroma. So two totally different gonads are going to come from the same intermediate mesoderms. Okay. Now again, this is the fetus, this is the head end, this is the caudal, and you can see this is the yolk sac. The yolk sac has been taken off, and this is the gut here. On either side, you see, this one side only we are seeing. On either side, we have this developing mesonephros and paramesonephros, etc. So somewhere at this region, some kind of elevation is going to happen. And for that, when this elevation is happening, there is something else coming from here, from the yolk sac, and they are coming like this, and then they're going over here, and then they're triggering this region. We'll see the specifics of that. So we just want to know that this is the gut. On either side of the gut, we have this kind of a tubes, two kinds of tubes. One is mesonephros and paramesonephros. And then this region, not here, not here, somewhere in this region, there is some kind of a thickening which is going to happen. That thickening, when it is happening, some cells are coming over here and then inducting that thickening more to differentiate. Okay. So let's take a section here. We are not going to study like this. It will not be clear for us. What we will do is we'll take a section over here. We'll take a section here, and this section we are going to rotate. See, this is the superior aspect. We are going to see from here. So this is the anterior aspect. This is the posterior aspect. So the posterior aspect, what we see is the neural tube. Here we'll see the gut here. So we're going to rotate a little bit. We have rotated 90 degrees. So what we see is the caudal part. This is the gut part. The posterior is like that. Now we have cut it. Upper part has been gone. Now we are going to tilt it. Okay, tilt in front, like this. Just we are tilting, slowly tilting. So that we'll see. We'll see this. Okay. So this part, what you're seeing right now is over here. This part, which has been tilted 90 degrees, so that the lateral view has become anteroposterior view, and what we are seeing is from above. Okay. Now this gut is this. This yellow is the gut over here. These two sides, what you're seeing is the mesonephros, paramesonephros. This over here is this one. Okay. So somewhere at this region, if we take a section, our gonadal ridges are going to develop somewhere over here. So this is the complete fetus, how it looks like, yolk sac, along with the fetus over here. So we are going to take a section over here, and then we'll see how it looks like. Okay. To take a section, this yolk sac is gone. This is the cavity here. This is the gut. On either side, we are having. So why? Because when we are talking about all the development, all these structures are going to go away. We are going to concentrate only over here. All these things will not be available. Okay. So we have taken this anterior portion of this body wall. We have taken one section over here. And then you can see this gut is there. On either side, these ridges are over here, the mesonephros and paramesonephros. Okay. Now at this region, we are going to have some kind of a elevation. So we'll take this picture. henceforth we'll use only this picture. So you can see this is the anterior, this is the posterior, this is the caudal part is there down somewhere, the above part taken off. And what we see is the gut here on either side. Either side we have this urinary system which is developing over here. Okay. So right. So now what we have to do, we know what stage we are in. So at this stage, around this stage, we need some organs or structures which are going to induce this. Okay. One is the primordial germ cells which are going to present over here, somewhere near to the caudal end on the wall of the yolk sac, somewhere over here. Okay. So it is coming over here. And the second one is the coelomic epithelium. The coelomic epithelium is there in the intermediate mesoderm and then the underlying mesenchyme. So this is the invagination. This is the gut tube which we have seen. On either side is what the urinary system is developing. So this part, this red structure, and then the under mesenchyme. Okay. So these things are going to get start proliferating, and this is what is going to contribute for the formation. So this is one component. This yolk sac primordial germ cells is another component. So this is going to reach here. Okay, it has to reach here. How it will reach, we will see. So these cells have to reach here and then communicate here, and then we need one more component, that's the SRY, to tell that. So this is going to be a male features or a female features. So this is the SRY, this is the Y chromosome. This region is called the SRY, testis determining region over here. So this place, this is where which determines whether this fetus is going to be a male or a female. Okay. So we'll take this, and we are not going to take anything off of that. So now when these are the four, what happens to primordial germ cells? What happens to these two, which forms the gonadal ridge? What forms the surrounding mesonephros and other things? And what happens to these? So each one we will see, and how this male and female are formed. Okay. Now at the region called the formation of gonadal region, we have if you see this the whole here, this whole region which has got thickened. You see the red region, only this part of it is been thickened. Okay. So this is getting thickened. Along with this, the already thickened part, see the whole thing, this was the connecting gut. The whole thing was elevating here, and apart from this whole elevation, one more medial to this, one small elevation is newly occurring, and it is not in the whole length, somewhere only in this region. And this region we call it as a gonadal ridge, and the rest of it we call it as a tubal fold. So this is the gonadal fold and a tubal fold. Here all our excretory system is going to get developed. All our mesonephros and paramesonephros, this mesonephros and paramesonephros are going to develop in this region, and this is our gonadal ridge. Okay. So if you see this, if you take off all this off and take only this and the nephros here, so this is over here, the center is the gut here, and on either side is our tubal, the mesonephros and paramesonephros. Medial to that, very medial to that, we have another elevation, and that we call it as a gonadal ridge. Okay. So this gonadal ridge is there both in male and female. Okay. At the same time, when the gonadal ridge is getting thickened, this cells over here, it starts moving. Okay. So you can see it starts from here. The yolk sac was there somewhere here. It started over here. It migrated like this, and then it goes along this dorsal wall, and this pink structure is the dorsal mesentery, by which the gut has been suspended. It goes along that, and then it turns over here, and here, which is already thickening, over there it goes, and then it goes and induces more. Okay. So this is the coelomic epithelium and underlying mesenchyme already ready to receive this primordial germ cells. Okay. So this yolk sac, from yolk sac, these cells over here are going to traverse over here this gut and then go along the dorsal wall in the dorsal mesentery and then go to the gonadal ridge over here and then communicate or induce it. So this is what happens from the endodermal cells, the walls of the yolk sac. The cells migrate and arrive at the gonadal ridge up only at the 5 to 6. And that is the reason up to 7th week, we do not know whether the gonad is male or a female. Okay. So at 6th week, all the induction starts. So this stage until 6th week of fertilization, weeks are indifferent gonad. So until the stage of indifferent gonad, this gonadal ridge is forming. This primordial germ cells are migrating. So these two things are happening, and still we are not sure whether this gonad is going to be a male or a female. Okay. Now, this gonadal ridge, when it is coming itself, it started to proliferate. After it has come, it proliferates much more. The cells of this wall and the mesenchyme over here proliferates more and sends a lot of cells over here. So this proliferating region becomes cortex, and then this receiving cells region, along with the mesenchyme, we call it as a medulla over here. So these cells are going to go in kind of a cords, cord kind of a structures. So they penetrate, and these are arranged in kind of a what is this called? It's called cords. So in line, okay, in a line. So many lines are there arranged properly in the mesenchyme of this. So we have a mesenchyme over here. We have some cells which are arranged like this. So these are called the primitive sex cords or primary sex cords over here. Okay. So again, we are not sure whether this is male or female. Okay. We know that this is the gonadal ridge. We know that the primordial germ cell from the yolk sac has traveled along the gut, along the dorsal mesentery, and communicating with the gonadal ridge. The gonadal ridge further proliferates and puts forth the primary sex cords. Okay. Now we want to know. Now that's it. So now this gonads are saying that we have to differentiate in some way or other. We need to know in what sex we have to differentiate. Until then, the sex is not known. So we call this stage as the sexual dimorphism. Now here comes the person who decides or tells the gonadal ridge that, okay, you differentiate into male or you differentiate into a female. And this is called the SRY gene, located on the short arm of the Y chromosome over here. So what is this SRY? It is examining region on the Y chromosome. And what does it do? It modifies or moderates the testis determining factor. Okay, and they, under the influence, if they are there, they produce male. If they are not there, they produce female. Okay. In later half of the slides, I'll tell you, irrespective of whether this gene is there or not, still some gonads will be forming because there are other influences of some other genes. So now this person has come. We have got gonadal ridge. We have got primordial germ cells. Now, what is this testis? This SRY gene will on the Y chromosome, which is coming and telling the gonads, okay, now this is the time for becoming testis. Now, testis determining factor, it will form, and then this primitive sex cords which are already there, they start to proliferate more and penetrate deep into the and break off from the epithelium. Now, once they break off from epithelium, they get connected to the mesonephros which are already there. I'll show you a picture, and they form the retate testis. Okay, the remaining of it forms the tunica albuginea. Right. Now, this is how it looks like. This is the gonadal ridge. It started proliferating and sending cords of cells. Now, once the SRY is telling that you have to become testis, these cords of cells breaks off from this epithelium. It breaks off from this epithelium and becomes and engulfs all the vessels over here which are coming from this mesonephros and paramesonephros, and then they communicate to this. This forms the duct of the male. Okay, so they communicate with this and they form the rete testis. So these rete testis. Now this is broken off. Okay, so this medullary component, these cells, the red colors are the primordial cells. They are engulfed by these invading structure, and now these are going to form the seminiferous tubules. Okay, and this communication with this forms the rete testis. So this is how it looks like. This is the coelomic epithelium. This is what the sex cords have come. It's broken off here and started to communicate with the mesonephros which are there. So this part of communication is rete testis. The one cords of cells which is engulfed the primordial germ cells, they become the seminiferous tubules. Okay, so this mesenchyme which are there, that white structures which are mesenchyme, they also have some kind of cells, and these are some cells. So if you know testis, the testis has got many cells. One is seminiferous, the Sertoli cells, so many cells are there. So all that are going to form here. Now once the SRY has decided, this primary sex cords are forming and this is forming. Now they start producing the hormones. Okay. Now this hormones called the testosterone and one more hormone, actually it's 3. So all they are going to maintain the production of testis and formation of other ductal system. Okay, so this is the mesonephros, this is the paramesonephros, this is the gonadal ridge. Okay, the gonadal ridge we have just lifted up because this is growing here. Now this part is the connection called the rete testis. This black ones are the engulfed primordial germ cells and this invading sex cord, which will gather together, canalize over here, and they become the seminiferous tubules. Now they have broken down from this coelomic epithelium, and this coelomic epithelium along with that some kind of connective tissue becomes tunica albuginea. Okay, so is it clear? So this is the gonadal ridge. The primordial germ cells have come here. They induced this. Even before that, they were already having this primary sex cord, and they proliferated more and they detached from the surface epithelium. When the cells had come, they engulfed that, they channelized it, some canal is formed, and that is the seminiferous tubules. Over here, the mesonephros at the same time, this mesonephros are proliferating blood vessels, and that proliferation starts communicating with this part, and this part of it becomes the seminiferous, rete testis. The rest of the surface epithelium, which is over here, becomes the tunica albuginea. So this is the how the testis looks like. Okay, this I will just slip this. There's small mistake in this. So there are some hormones which are going to produced by this once they form, the SRY comes. The one is the testosterone. Another is what I put is the Mullerian inhibiting substance factors. Okay, so now if you see this, this is the coelomic epithelium. These are the seminiferous tubules with the engulfed cells over here. These are the sex cords here. They have communicated with the mesonephros here, rete testis, and these are the seminiferous tubules. And now this vascular epithelium has been invaded. Now these are two types of cells are there. One is the axial spermatogonia, and in the interstitial cells over here, the remaining whatever mesenchyme, they form the Sertoli cells. So they secrete few kind of hormones. One, to sustain the growth of this. Another is to inhibit the action of the female organs. Okay, so now the primordial germ cells and the sex cords form the seminiferous tubules. The surface epithelium over here, what remaining over here, will go the earlier ones which has shifted here. Whatever didn't go and form the seminiferous tubules but are floating inside the medulla over here, these kind of structures, they form the Sertoli cells. And rest of the mesenchyme, etc., they will produce some Leydig cells. and rest of that forms the tunica albuginea. Okay. So, and the duct systems are formed by the mesonephros. Now, all these things, to maintain this and to further development of it, we need the testosterone, which is being produced by these cells over here. And also we have another one which will inhibit the production of the female organ. So, three important hormones. There's another few more are there. So one is testosterone, one is insulin-like, and another important is AMH, that is anti-Mullerian hormone, or you can say anti-Mullerian hormone. This is important because this will inhibit the formation of the female ductal system or female sex cords or etc. So this is for promotion, this is for inhibition of female ones, and this is for, we'll come to that when we were doing that. This actually is the one which will get the testis more, it'll, we will see that when we come for that. Okay, there's something like descent of testis where this is important over here. And after all this, under the influence of this and few more hormones, now the gonads are going to become a testis under the influence of all these hormones over here. Okay, so in case these are not performing very well or something like that, or it is not maturing properly, now we have something come across the germ cell cancers, which are thought to be because of some primordial germ cells which has not completely come to the gonadal ridge, and they are becoming, because it is a germ cell, it becomes like a germ cell tumor. So nowadays these testicular cancers are coming up, and they thought that this is because of the primordial germ cells, which is not completely differentiated or has failed to reach the gonadal ridge, and still they are active and they can cause the cancer cells. So because of this, they need not really become turn into cancer, but they could lead to something else. The anomalies of testis or reproductive system, or even sterility, small testis, or the testis need not come into the desired place. So the primordial germ cells need to do the work appropriately at the appropriate time for all these anomalies not to happen. Okay? So these are not uncommon anomalies. It's quite common. This small testis, we get every other day patients, undescended testis, small testis, and gonad which is not known whether it is a male or female, and the failure of this reproductive tracts and anomalies of this testis. Okay, maybe it is only postulated, still we are not completely confirmed. Okay, and what to do with Sertoli cells and infertility? We have these Sertoli cells which are part of this production of this testis, making of it. What has this got to do with infertility? Now, these Sertoli cells, they start and disappear and again reappear in puberty. Now, these are fixed number of cells. The germ cells are there. They go and support those germ cells, and their numbers are fixed. So, they determine the number of Sertoli cells, determine the amount of sperm output. Okay, until 6 months it is there. Later on it disappears and reappears during puberty. Okay, now if they are not enough formed because of some timing difficulty, or the hormones are not secreted properly, or the primordial germs have not invaded properly, something has happened and there are less number of cells. So if there are less number of cells, there is a possibility there is a less amount of sperm quantity, and also the testis could be small because the cell numbers are less, because Sertoli forms quite a number there. So testis